Pet Industry Academy. Capacitación para la industria de animales de compañía.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Empezamos Pet Industry.
Hola, hola, buenas noches Pet Industry. Gracias por cumplir esta cita que tenemos hoy 7 p.m. para un momento de estudio, de academia. Nos invita esta noche Invet y con su aliado Beto Quinol. Y bueno, yo por aquí ya veo que hay varias personas saludándolos. Les quiero dar un saludo a Catherine, Lina Gómez, Carlos Franco, César Reyes, Mac Alonso, quienes llegaron muy puntuales, agradeciendo también la puntualidad de todos. Ediel, Gabriel Herrera, Daniel Jaramillo, Carolina Suárez, Valentina Nieto Giraldo, Vivien Sánchez, nos saluda y nos dice buenas noches, gracias por la invitación. Gracias a todos ustedes por acompañarnos. Bueno, vamos a tener aquí una dinámica muy interesante. Vamos a tener nuestro speaker, ya se los presento, pero también vamos a tener la compañía de una persona de Invet muy querida, muy conocida por todos ustedes. Se trata de la doctora Anaín Giacometto, ella es la directora científica de la compañía. Anaín, bienvenida, ¿cómo estás?
Alex, muchas gracias a todos por asistir a esta charla que vamos a tener. Muchas gracias a ti por el espacio y pues nada, esperemos a que se vaya conectando más gente para poder arrancar con nuestro maravilloso speaker desde Francia que nos va a acompañar esta noche.
Y bueno, recordando pues reglas de juego en general, ya saben que yo estoy aquí muy pendiente de varias pantallitas, guardando los comentarios, las preguntas, para que al final las podamos atender muy dinámicamente. Y también porque durante la presentación se van haciendo preguntas que son similares unas con otras, entonces podemos agruparlas todas en una gran respuesta y pues así nos rinde mucho más el tiempo. Además que nuestro invitado pues en este momento desde Francia son la 1 de la mañana ya, entonces está muy madrugador. Les quiero presentar, nos está acompañando el doctor Nicolas Giraud, él es gerente técnico global de exportaciones de Beto Quinol, un médico veterinario con amplia experiencia en cirugía y manejo de casos clínicos complejos. Su trayectoria incluye investigación en cirugía para el uso de células madre en trasosteotomía niveladora del platillo tibial en perros, máster en biomecánica, tiene experiencia práctica en cirugía en clínicas privadas, amplio conocimiento en el manejo técnico de productos para la industria veterinaria global. Y bueno, pues Nicola nos va a compartir su experiencia sobre el impacto de la inflamación en la osteoartritis y cómo los veterinarios pueden optimizar su manejo clínico pues para ofrecer un mayor resultado a las familias. Nicola, salud, ¿ça va?
Hello, hola Alex, muchas gracias por la presentación y muchas gracias a tú Alex y a Nain para la invitación. Entonces, esta noche voy a presentar una presentación que habla de inflamación y de osteoartritis. Mi español no es el mejor, pero lo siento, pero voy a presentar en inglés porque
Okay.
es las 1 de la mañana y mi español no soy seguro. Entonces, es mejor en inglés para todos.
Y la presentación, quiero decirles, está en español.
Sí.
Él la va a ir haciendo en inglés. Y pues aquí está de soporte Anaín. También vamos a estar en backstage. Pero ya, Doctor, you can start the presentation when you want. And we will be here if you need anything or the audience asks something.
I did share my screen. Is it okay?
Yep.
Yeah?
But it is not in full screen.
And now?
Yep.
Yeah, it's good?
It's good.
Okay, perfect. Thank you. So, tonight we are going to talk a bit about inflammation and osteoarthritis, and we will see that in a few different parts. So first a little introduction, then a bit of physiopathology, because it's always interesting to understand really well why it's so important to act on inflammation. Then we'll see the relation between inflammation and pain in osteoarthritis, how osteoarthritis is evolving and why it's so important to treat inflammation. And then we will finish with, well, how you can manage inflammation with our solution in Vetoquinol, and also the engagement of Vetoquinol in this field. So let's start with the introduction. So first, well, you know that more and more our pets, they live longer and longer. And this is because of several things. Because, well, we have better preventive medicine, because we have a better nutrition of the pet, we have better vaccination. And overall, all this is improving because the bond between the pet and the pet owner is really increasing during the last years. And because of this bond, there is a need that is the need for us, for vet, to take care of the pet. And because we take care better of the pet, he lives longer. But because he lives longer, then we have pathologies, chronic pathologies, that are more and more frequent. And it's a bit of the same for the human. You know, we live longer and longer. So, well, we have more chronic pathologies. And unfortunately, with chronic pathologies come chronic pain also. And actually, osteoarthritis is one of the first, let's say, culprit of chronic pain in animals. And this is mainly because it affects a lot of dogs. And you can see that around 20% of dogs are affected by osteoarthritis. It depends a bit between studies, but it's most overall, that's what's admitted. And we also know that the older the dog, the more risk, of course, of having osteoarthritis. And when you reach 8 years of age, usually we are at 80% of dogs with osteoarthritis. So it's a very high percentage of dogs. Osteoarthritis, what is it? Well, it can be defined as a lesion of the articulation with a deterioration of the cartilage. But it's not only a deterioration of cartilage, it's also formation of osteophyte and change in the bone, in the bone tissue that is happening. And actually, we will speak more about it, but it's not only this, not only the articulation and the bone, it's really an overall disease of all the structures around it. So osteoarthritis is something that is going to create chronic pain in dogs. And it's also something we can see in young dogs, because actually 40% of dogs that are less than 8 months, they are going to present radiological sign of osteoarthritis. And in 40 to 60% of those dogs, there is already clinical signs. So it's really a disease that is very important, especially in dogs, but actually in cats also. Tonight, I will talk mainly of dogs, but in cats, if you look in the studies, we see that 60% of cats that are 6 years or more, they present at least one joint with osteoarthritis. And if you go to 12 years, it's 90%. So it's not only dogs, it's cats also, but tonight we'll talk mostly about dogs. Now, in terms of osteoarthritis, well, it is a disease that is very, let's say, eclectic. There is very different risk factor around osteoarthritis. And well, we can divide the factors in 3 big types. There are factors that are going to be changeable. So that's, for example, if the dog is castrated or not, if the dog is obese or not. Castration is going to increase the risk of osteoarthritis. Well, we don't know exactly the mechanism. What's most probable is because, well, a dog that is castrated is going to have a bit less muscle, and also, well, it will tend to be more overweight if it's not obese. And weight is a very, very big proponent of formation of osteoarthritis. So whenever you have animals coming to the clinic with osteoarthritis, really acting on the weight is very important, because it's really one of the premier factor, because the more weight you put on the articulation, the more damage you are going to create in this articulation. Then, of course, there are factors that you cannot change. So it's like the sex of the animal, the breed, the age. And of course, we know that, well, the more the older the dog, the more prone he will be to osteoarthritis. And same with the breed. Well, the bigger the breed, the more prone he's going to be to have osteoarthritis in his life. And the smaller, the lesser. A Yorkshire will usually have osteoarthritis when he will be very old. A German Shepherd, it can be very early in his life. And after that, well, you have all the arthropathies that are going to be, of course, leading to osteoarthritis. So dysplasia, osteochondrite dissecant, all those arthropathies, because as soon as you have a malformation of the articulation, as soon as you have a little something in the articulation that is going to make it not work exactly properly, is going to increase either the usage or it's going to create a damage. And once you have a damage on the cartilage, you will inexorably advance in the disease of osteoarthritis. So now that we know that osteoarthritis is a very, let's say, important disease for our dear dogs, well, let's look a bit more on what exactly is the physiopathology of the disease and why inflammation and controlling the inflammation is so important. So when we look at osteoarthritis, we look usually at just the cartilage and we say there is damage to the cartilage, that's why the animal is painful. But actually, the osteoarthritis is really a disease of all the joint, and even, I will say, all the tissue around the joint also. Because there is a crosstalk of all the structures of the articulation. So all those structures, they are going to talk between each other. And once you have inflammation, because you have a degradation of the cartilage, you have a damage of the cartilage, then you are going to have inflammation in the synovial fluid, then you are going to have inflammation in the bone, so you are going to have inflammation of the subchondral bone, you are going to have inflammation that is going to create osteophyte and tesophyte, you are going to have inflammation that is going to create fibrosis of the articular capsule. So all those structures, they talk to each other. And outside of the synovial capsule, you will have tendons, ligaments, muscles that will also receive the signal of inflammation, and so that will act also on them. So it's really important to understand that it's not only the cartilage that is diseased. It's because the cartilage is diseased, is going to affect all the structure around. So when you treat osteoarthritis, you have to remember that it's all the structures around also that you have to take care of. So if we look more specifically to the cartilage, the articular cartilage, during the disease, the cartilage is progressively going to lose its structure and functionality. And this is going to happen in, let's say, 3 main steps, okay? Those steps are not like 1, 2, 3, okay? It's really a progression. And also mostly the 2 first, they are more or less active at the same time almost. So first, that's when you are going to have all the damage to the, well, the first, let's say, damage to the cartilage. When you look at cartilage, you have to understand that it is like a building, meaning there is a structure that is made of collagen, and the collagen is really, it's a grid. It's the structure of the collagen, of the cartilage. And in this grid, you have molecules that are called glycosaminoglycan. They are very big molecules that are going to attract water. And this is going to inflate the cartilage. And because you have the grid and this inflation, this gives the structure to the cartilage. This gives the strength and the ability to absorb shock to the cartilage. But as soon as you have a destruction of this grid, as soon as the collagen grid is not perfect anymore, well, the water intake is going to increase, so it's going to inflate the cartilage, and the cartilage will not have its functionality anymore because it will not be able to resist the shock anymore as it was before. And because of that, it's going to increase the damage to the cartilage. And because you increase the damage, you lose even more functionality, and so on and so on. And because of you have that, well, you have in the cartilage some cells that are chondrocytes that are going to try to proliferate and to be more active, to try to help the cartilage, I say, because you will never manage to heal the cartilage. That once you have damage, and you will never get a new, fully, let's say, working exactly as before cartilage. So you have those chondrocytes that are going to try more or less to do a kind of cartilage that is less functional and less resistant than before. But at some point, well, they will not be able to keep on with the destruction, and you will lose totally the structure of the cartilage, and, well, you will have nothing anymore. And that's, let's say, the end stage of the disease, where you really have no more cartilage, and it's just a subchondral bone that you see if you do an arthroscopy, for example. When we look at what's happening in terms of molecules at this level, well, there is a lot of inflammatory mediators that are coming into play. And you can start to see why inflammation is so important. It's because you have all those cytokines, interleukin 1, 17, 18, TNF-alpha, that are going to provoke all this inflammation, and this is going to increase the production of metalloprotease and aggrecanase, and this is going to increase even more the destruction of cartilage. So because you have destruction of cartilage, you have an inflammatory response. Because you have an inflammatory response, you increase the damage to the cartilage. And so, well, you can see the vicious cycle that is coming into play. And you have also, of course, the free radicals that are going to create a lot of damage. Now, if we don't look at the cartilage anymore, but if we look at the synovium, so the synovium is like the capsule of the articulation. And there we're going to see several things. We are going to see, well, the first and most important thing is like the synovite and fibrosis. So synovitis is because of the inflammation of the capsule. And because of the inflammation, you are going to have a creation of this fibrosis. And because you have fibrosis, you lose the property of the articulation to move properly, because it's going to be much more stiff than it was before. You are going to have, of course, histologic change. of this synovium. So you are going to have an hyperplasia and hypertrophia of the synovium. And you have an infiltration also of the tissue by lymphocyte. And this is again because of inflammation. The last thing that you will see is that because you have degradation of cartilage, you have parts of this cartilage that is going to go in the synovial liquid, and it's also going to go in the membrane. And as it's not supposed to be in the synovial fluid or in the membrane, it's going to create the formation of collagenase that are going to, well, destroy this collagen that is not supposed to be at this place. But those collagenases are not going to stay there. They are also going to increase degradation of cartilage in the end. And the last part that we need to see when we look at the physiopathology of osteoarthritis is the subchondral bone. And at the level of the subchondral bone, we are going to see two main things. So we are going to see a formation of osteophyte. So we will see it mostly at the place where the cartilage and the subchondral bone, they unite. And this can provoke some symptoms, especially, for example, if it were to hinder the capacity to move. It's more, let's say, a problem of blocking because of the size of the thing than it is because it's create damage or something else. And then, of course, you are going to have the subchondral bone that is suffering, and because of that, it is going to lose its properties. So it's going to lose its porosity, it's going to become sclerotic, and it's going to be painful, and it's not going to be able to absorb the shock as it was to do before. So, well, you see the physiopathology of the osteoarthritis is very complicated. There is a lot of structures. There is a lot of factors that comes into play. What I presented to you is really a summary of what's coming to play. And you can already see that inflammation is the main component of the disease. And because of inflammation, well, you have all this degradation of tissue, and all this degradation of tissue is going to create pain. But the inflammation also is going to create pain. We are going to see a bit the relation between those two things. And first, well, there is two types of inflammation. You have acute inflammation and you have chronic inflammation. And I present this to you because it's the same with pain, and we will talk about it after. And we can see, let's say, a concordance between acute inflammation and acute pain, and chronic inflammation and chronic pain. Because an acute inflammation is something that is normal, that is here to, let's say, to help the body to defend itself against pathogens, against damage, against all things that are not, let's say, physiological. But when you have chronic inflammation, this is an acute inflammation that evolved into chronic because the immune system response was not sufficient enough to defend the body against, for example, a bacteria or a wound or something. And this is when you have development of a chronic inflammation, and chronic inflammation is going to persist in time. So you are going to have it for weeks, months, and sometimes even more. And for example, in case of osteoarthritis, you have chronic inflammation, and this chronic inflammation can be for years. You can have an animal that is with osteoarthritis from his second year to his 8, 9, 10 years. So what's the relation between inflammation and pain? Well, first a bit of recap on pain and why pain also is quite difficult in vet medicine is because, well, the pain is a sensory and emotional experience. And in humans, well, we can easily describe verbally what we feel. And well, a dog cannot. So it's something that is very specific to our field, because as vet, well, we yield animal, and it can be quite sometimes challenging to know if the animal is in pain or not, because some animals will tend to hide if they are in pain, and some animals will tend to maybe become aggressive, or some animals will tend maybe to limp and some not. For example, a cat, you will never see a cat coming to your clinic limping because he has osteoarthritis, because he will hide his pain. So as we have our acute and our chronic inflammation, we have our acute and chronic pain. And it's a bit of the same, meaning that the acute pain is something that is short in duration, that is very high in intensity. Usually it can be more or less high, it depends, but it's usually something that is high compared to chronic, that is more, let's say, on the back burner. And that also is associated with lesion. So you have an acute pain because you have an acute lesion. In chronic pain, this is a chronic condition that can be for, again, weeks, months. In human medicine, they consider that chronic pain is for at least 3 to 6 months. But because in vet medicine, our animals, they don't live as long as us, is it really relevant to consider it chronic only when it's 3 or 6 months? We can wonder. So we have to put that a bit in perspective. Maybe for us, chronic could be shorter than that. And usually you have, like for inflammation, you have, it's not, you don't go from acute to chronic like that. You have an acute condition that is going to slowly evolve into a chronic condition. And here it's pain, so you have an acute pain that is slowly going to evolve in a chronic pain. And it's the same if you were to look at stress that is acute, and if you have a lot of stress all the time, it can develop into anxiety that is more chronic. So with this concept of acute and chronic pain, there is another concept that is now described, is adaptative and maladaptative pain. Because you have a pain that is adaptative, that is here to, let's say, protect the body, because, well, you are going to put your hand on a burner and you are going to take off your hand. The pain is going to make you take off your hand, is going to protect you from more burn. And this is also something that is going to be reversible, that there is something that is causing it that you can identify, so there is a cause to it. And again, you have this high intensity and it's acute. But on the other side, you have the maladaptive pain that is not here to protect anymore, because it's not like you don't put your hand on the burner. It's just you have a condition that is not healing properly. And actually, when you have chronic inflammation, of course, is going to act on tissues that we usually think about, so the cartilage, etc. But this magma of inflammation and inflammatory parameters, they are also going to act on nerves. and they are actually going to activate certain type of nerve fibers that are responsible for chronic pain. And it's because you have activation of those nerve fibers that you have the switch to this chronic or maladaptive pain that we describe nowadays. And this maladaptive pain is not reversible, because if you don't treat it, if you don't use pharmacology, it will stay. So you need something to treat it. You cannot detect a cause that is recent. It's not your end of the burner on the burner anymore. It's something that is rampant for quite a long time. And usually the pain is not as high, but it's just always present. And because also it's always present, you have this phenomenon of hyperalgesia that is arriving. And hyperalgesia is the fact that a normal stimuli that will not create pain is going to create pain. So, for example, if you have osteoarthritis in your hand, and if you don't have osteoarthritis in your hand, you do that, it's not painful. If you were to have osteoarthritis, for example, in your hand, maybe doing that will be painful to you. And this is called hyperalgesia. This happens when you have this maladaptive pain. So when you have your adaptive pain, the normal, the acute one, there is a nociception and there is an inflammatory also component to it. When you have a maladaptive pain, this is the neuropathic pain I was speaking about. So the activation of certain nerve fibers, and it's also a lack of functionality of the tissue. So, for example, in the case of osteoarthritis, you don't have the mobility anymore because you lost it, because there is fibrosis, because there is not the capacity of the tissue to absorb the shock anymore. So there is also a functional component to it. And when we look at those two types of dolor, as they are not exactly the same as the acute and chronic dolor, because acute dolor is only the nociceptive one and the inflammatory acute one, let's say. But inflammatory chronic can also be adaptative until some point. But then you have neuropathic and functional that are maladaptative. So it's a very wide spectrum, let's say. And well, as I started to tell, when you have maladaptative pain, that's when you need, let's say, more pharmaceutical tools to treat it, because it really needs to be taken care of with specific or more drugs, let's say, than classic chronic pain. So in the case of osteoarthritis, we usually have different factors that are in play. We already spoke about it. And one type of factors that are important, they are all the arthropathies. And all the arthropathies, they are going to create damage and they are going to create pain. And when you have this type of problem, you usually have an osteoarthritis that is going to advance much faster than if you were to just have an old animal or maybe an obese animal. And of course, well, you have other factors, but those are the ones that will create the most osteoarthritis the fastest. For example, if you have a cranial cruciate rupture, you will have osteoarthritis developing really quick. So if you don't operate and treat the rupture, in weeks, months, you will have development of osteoarthritis, and it will be very quick. So again, I really want to emphasize the fact that when you have osteoarthritis, it's not only the joint that is at, let's say, at arms. it's also all the other things that are around the joint. And well, we saw that the physiopathology of osteoarthritis is creating a lot of inflammation, and because you have inflammation, you have degradation and so on and so on. But because you have osteoarthritis, you also have pain, because the damage is going to create the inflammatory mediators that are going to create pain. And we could just say stay at this level, but actually the pain is also going to create more damage. So it's not only the inflammation that is creating more damage, it's the pain also. Because you have pain, you are going to move less. And because you are going to move less, you are going to have a muscle atrophy, you are going to have articulations that are becoming stiffer quicker. And this is also going to create more damage to the cartilage. So you see how inflammation and pain are linked, and you need to treat both of them in case of osteoarthritis, because if you treat only the pain, then you treat this, but inflammation is still there, and you still have a vicious cycle of inflammation. So you still have your cartilage damage that is going to create inflammation. You increase inflammation again, and you increase damage, and damage meaning that you have more damage to the cartilage, and so on and so on. But if you don't, so if you treat only pain, you have inflammation that is staying. But if you treat only inflammation, you have the pain that is staying, and so you have all the stiffness, the muscle atrophy, etc. So it's a multifactorial disease, and it must be also, let's say, evaluated in this aspect. So now, just a few words on evolution, on how the osteoarthritis is evolving and why we need so much to use a specific type of products that are the NSAID. Well, as you can see on the graph, it's not a stable increase in time. It's an increase in time with spikes. And this is important, very important to remember, because each time that you have an osteoarthritis crisis, this is the time where you have the most formation of osteoarthritis in the joints. So each time you have a crisis, you need to put an NSAID to break the inflammation and to break the pain. You can keep your support treatment. So the first support treatment you should have, the first thing you should do is to educate the pet owner. That's the most important. Then it's to, if the animal is obese or a bit overweight, is to reduce the weight. Then it's to put in place feed supplement that can help to alleviate the symptoms and that don't have any side effects. Then it's physiotherapy. And when you have crisis, or if all this is not sufficient, then you will put in place an NSAID. But I really insist, when you have a crisis of osteoarthritis, you need an NSAID for a long period of time. And when I say a long period of time is minimum 2 weeks. I would most of the time do at least 4 weeks, and maybe if needed more. But I think to me 4 weeks is a good landmark. So it's very important to treat at this moment to avoid formation of too much osteoarthritis. So again, it's just to show the different stage of the disease. And you have, of course, the subclinical stage. So those are animals that are predisposed, for example, to have osteoarthritis, and you know that it's either almost sure or very likely that they will develop in time. And so those animals will really benefit from pet owner education. This, again, I emphasize, this is the most important. And they will also, in some cases, benefit from supplement. And once you have the disease that is here, that you have the clinical signs, well, at some point, for sure, you will need to use pharmacology. Again, the first pharmacologic treatment you should put in place is an NSAID, because an NSAID is going to treat the pain and the inflammation. And as I showed you, it's very important to treat both of those things in osteoarthritis. So now a bit of, well, what do we propose in Vetoquinol to help you with this? And our new product, Simaljex, that is coming to Colombia. So Simaljex is an NSAID. It's a treatment for osteoarthritis or post-operative surgeries. So it can be it can be soft tissue or bone surgery. It's a 2 milligram per kilo once a day treatment that you can use up to 6 months. Well, it's not that you can use, it's registered to be used up to 6 months. You can use it with or without food. There is a very high safety index of the product. You have different tablets. I will show you the tablets. They are dividable. So the 8 is dividable in 2, the 30 in 3, and the 80 in 4. And it's only for dog product because the cats, they have a lack of an enzyme, hepatic enzyme, that makes the cimicoxib staying too long in their body. So you cannot use the product. So Simaljex is cimicoxib. It's a product you will only find in veterinary presentation, and it's what we call a coxib. So a coxib is a selective COX-2 inhibitor. This means that we are going to avoid as much as possible to inhibit COX-1. And to give you an example, this is calculated in a ratio. And if you were to look at meloxicam, the ratio is 1 to 16, meaning that for 17 molecules of meloxicam, 1 will go on COX-1 and 17 will go on, and 16 will go on COX-2. For cimicoxib, it's 1 to 286. So meaning that if you have 287 molecules of cimicoxib, 1 will go on COX-1 and all the rest will go on COX-2. So you really select COX-2 when you use a coxib like cimicoxib. And it has an efficacy that is proven as anti-inflammatory, anti-edematous, antipyretic, and analgesic. So quickly, why it's important not to, well, to inhibit COX-1 so much? Well, first, why it's important to use an NSAID and not a corticosteroid is because in the case of osteoarthritis, you don't need a corticosteroid. A corticosteroid is a very potent anti-inflammatory. But is going to have much more side effects than an NSAID. So an NSAID is much more adapted to the disease, and it's also a bit better for pain management than the corticoid. Then, if we look really more at COX-1 and COX-2, well, you know that you have your inflammatory cascade that starts with the arachidonic acid, and then you have in one way an enzyme that is called COX-1. So this presentation is very black and white. In reality, it's much more gray, but overall, it's mostly true that COX-1 is the COX that we say is a good COX, meaning that it has physiological properties and especially homeostatic properties for the GI tract. And COX-2 is mostly the bad COX that is going to be more the inducible COX that you will find more when you have inflammation. So again, this is very black and white. It's not totally true, but it's mostly true. And this is why we want to try to, as much as possible, focus on COX-2, because this is the main culprit of inflammation and pain in those cases, and not so much on COX-1, because it's when we inhibit too much COX-1 that we risk to have more side effect on the GI tract. So after that, well, what about Simaljex? So Simaljex, as I told you at the beginning, you can use it with or without food. And this is a very interesting properties because, for example, you have other products like Grapipran that you need absolutely to give to an animal that is fasted and to wait for 1 hour before giving food again. Here, you can give with or without food, so meaning that even if the animal maybe is not willing to eat this morning, you can still give him Simaljex, and the bioavailability of the product will not be changed, and you will have the same efficacy for the same duration of time with the product. So it's a very convenient property of the product. Then there is the safety. And safety, with NSAID, there is, of course, the GI tract safety. But one thing that we usually are very afraid, especially when I tell you to do a 4-week treatment when you have an osteoarthritis crisis, is kidney damage. And with cimicoxib, there is first the properties of the product that I'm going to show you now, and then I will show you a study that we have done in intern in Vetoquinol that show how good the product is in this case. And so the first thing is to look at the elimination of the product, because cimicoxib is going to mostly be eliminated via an inactive metabolite. And this inactive metabolite will mostly be in the feces and a little in the urine. The cimicoxib active molecule will only be present in a small amount in the feces and absolutely not in the urine, meaning that you have no concentration whatsoever of active cimicoxib in the urinary tract. So this first property really enables the product to avoid to have too much side effect on the kidneys. And now this shortly is a study that we have done in Vetoquinol to show the property of cimicoxib and to show that it's actually safe to be used in moderate chronic kidney disease for a short period of time. And this is actually, I think, the only NSAID that is registered to be used in chronic kidney disease animal, moderate chronic kidney disease, for a short period of time. So the study in question was a study where they created chronic kidney disease in experimental dogs. And once the dogs were acclimated to their chronic kidney disease, they did a treatment for 10 days with cimicoxib. And during this treatment, they did blood samples and they looked at the pharmacokinetic of the molecule inside the dog, in the dog bloods. And what you can see is that there is no difference between the dog that was healthy and the dog after the surgery that was with his CKD in terms of pharmacokinetic. And the product was used at the same dosage, 2 milligrams per kg in both cases. This means that you can use cimicoxib, Simajex, in mild cases of CKD for a short period of time without changing the dose of the product. So in summary, Simajex is really, it's a very easy product to use because you have the different size of tablets that are very easily dividable into 3 or 4, depending on the size. It's a palatable tablet also, so it's easy to give to the animal. You can give with or without food. So again, it's very convenient because you don't have to be worried if the dog is eating or not in the morning. You have the 3 concentrations that are really helpful to have the exact amount you need for the dog, because we know that if you give exactly the good amount, you have the effect you are looking for, and you reduce the side effects that could be possible if you were to have a bit too much of product. It's very safe because, well, you don't have any elimination of active cimicoxib in the urine. You have also, I didn't show you everything because it's too much, but we have done a lot of studies on toxicity of the product, and we look especially at hepatic and cardiac parameters. And in all studies, they were very stable. There was never any significant change. And there is also an excellent gastrointestinal safety of the product, because again, those safety and tolerance studies, we have done endoscopies and we never had any lesion of the esophagus or the stomach. It's a very effective product. I mean, it's as effective as you would expect any anti-inflammatory to be. So you will have an excellent analgesia. We compared it to buprenorphine, and we found a similar analgesia as buprenorphine in cases of soft tissue surgeries. And it's very quick to be active in the blood. And now just some word to show you that, well, in Vetoquinol, we are really engaged in the mobility field, and we are really engaged into providing good quality product and a lot of knowledge and solution to our vets. Because every year, for example, we have a big kind of congress, let's say, with experts in mobility that are going to create different tools to help everyday vets, you, me, to better manage osteoarthritis. And for example, what you see on the screen is a graph to help to decide what kind of treatment I put when for a patient with osteoarthritis. So for example, this type of tool you can totally use for your clinic. And also we are engaged, for example, with the WSAVA, and we are partner with them on their guidelines of pain. And you can find also some recommendation of the expertise on the website of the WSAVA. Here also, if you want, you can have a look at what we have done that is present on the website of WSAVA. And the tool I showed you just before should be in those elements. Here you have the technical files of SIMARJAX, and you see here's the three type of presentation we have. So the 8, the 30, and the 80. I will leave you a bit this QR code if you want to take it. So you will have all the description of the product. And yeah, that's all for me. Do you have any questions? I will just put this back if you want to look at it.
Nicolás, muchísimas gracias. Tal como les escribí a todos por el chat, vamos a hacer las preguntas que tengamos, tanto en inglés como en español, para que Nicolás nos pueda colaborar con esas respuestas. Ya hemos encontrado varias preguntas desde redes sociales, porque les recuerdo que este video va a quedar colgado en YouTube, en Instagram y en Facebook para que ustedes de pronto lo puedan volver a revisar. Pero ya nos han hecho varias preguntas, entonces vamos a hacer una pequeña ronda de preguntas. Veo que por el chat también nos están haciendo otras preguntas. Muchísimas gracias por hacerlas en inglés. Igualmente las vamos a traducir para que todo nuestro público las pueda conocer. Nicolás, thank you. Thank you very much for all your help, for all the information you just gave us. We have a lot of questions, and we're going to begin with some of them. Many of them are very, very interesting. And we're going to begin with this one, which is the real impact of synovial inflammation and osteoarthritis progression, and what strategies can effectively minimize it. Para las personas que nos están siguiendo, la pregunta es: ¿cuál es el impacto real de la inflamación sinovial en la progresión de la osteoartritis y qué estrategias pueden ayudarnos a minimizar de manera efectiva? Okay.
So the inflammation of the synovium, the impact is, you have several types of impact. First, you have inflammation in the synovial liquid. And because you have inflammation of the in the synovial liquid, this is going to be transferred to the cartilage, and this is going to increase degradation of the cartilage. And then you have, in the synovium, you have also the capsule. And because you have inflammation of this capsule, the capsule is going to have an hyperplasia and an hypertrophia, and in the end, a fibrosis. And this is going to create, let's say, an articulation that is becoming stiffer and stiffer. And because it's stiffer, you have less movement. And because you have less movement, you actually increase inflammation.
Okay.
So it's overall, it's a very vicious cycle. What you can do, so, well, first thing you can do is put in place.
Let me translate first.
Oh, you want to translate? Okay.
Yes, I'm going to translate so everybody could understand everything, okay? Nicolás nos está comentando precisamente que con el tema de la inflamación a nivel de la sinovia tenemos un inconveniente muy serio, que es que el líquido sinovial va a terminar igualmente inflamando todo lo que es el cartílago. Una vez se inflama el cartílago, vamos a tener una inflamación subyacente que va a implicar la cápsula sinovial, y todo este proceso, en pocas palabras, va a terminar generando una hiperplasia con una hipertrofia y, por supuesto, una atrofia. El inconveniente que se tiene principalmente con este tipo de procesos es que se va a generar una reacción en cadena que va a terminar generando igualmente dolor, y el dolor va a producir aún más inflamación. Entonces, se vuelve una situación de un círculo vicioso en el cual la inflamación y el dolor son los que priman, y por lo tanto pues el proceso osteoartrítico se va a complicar. Ok, go.
Ok. Entonces, ¿qué puedes hacer? Es la primera cosa que puedes hacer es que dar un N, porque un N va a disminuir la inflamación en toda la articulación. Entonces, es un farmacólico tratamiento que puedes ayudar con esto. Y una otra cosa, porque hay fibrosis, es que puedes hacer fisioterapia. Porque con fisioterapia tú vas a mover en la articulación and it's going to be less stiff. It's going to be less stiff because of the physiotherapy.
Okay. Entonces, lo primero que nos va a ayudar en el proceso es el uso, por supuesto, de un AINE. El AINE es la terapia farmacéutica o el producto farmacéutico por elección que nos va a permitir tener una desinflamación y un control del dolor. Y lo segundo que debemos hacer es fisioterapia. Esto nos va a permitir la movilidad a nivel de la articulación y va a disminuir el impacto que se está generando sobre esa articulación. Ok, go.
And that's I mean, that would be my recommendation to affect the synovium inflammation, especially. But
okay.
Anyway, it's not only the synovium inflammation that you will act when you do that. It's overall all the pathology of the osteoarthritis.
Okay. Otra pregunta, another question. As osteoarthritis is multifactorial, how significant is the role of chronic inflammation compared to other factors such as cartilage degeneration or bone remodeling? What is the real impact of this inflammation between all the osteoarthritis disease? La otra pregunta que tenemos es, dado que la osteoartritis es una enfermedad de tipo multifactorial, ¿qué peso tiene la inflamación crónica comparado con otros factores como, por ejemplo, la degradación del cartílago o la remodelación ósea? Okay.
Okay. So, good question. So, actually, it's difficult to answer. It's not really like you have to see that it is each thing is part of the disease. So the chronic inflammation is actually the main component of the disease. Because if you were not to have this chronic inflammation, you will not have the degradation of the cartilage, you will not have the change of the capsule that is becoming fibrotic, you will not have the formation of osteophyte. So it is because you have this inflammation that you have a degradation, and because you have the degradation, you have an increase in inflammation, and so on and so on. I don't know if I'm being clear or not.
Yes, of course. Nicolás nos comenta que precisamente pues esto se termina siendo un proceso de unos pasos que van a terminar afectando a los otros. Entonces, lo principal es precisamente la inflamación crónica, y sin esa inflamación crónica, pues a la final el tema de la remodelación ósea y de todo el inconveniente que se empieza a presentar con la degeneración a nivel del cartílago, pues no se estaría presentando. Entonces, lo más importante es manejar en todo este proceso tanto el dolor como la inflamación, teniendo en cuenta que ya son crónicas y que estos son los que terminan dando paso a los demás signos que se encuentran en este tipo de enfermedades multifactoriales. ¿Ok? The third one, is there any recent clinical study proving that early inflammation control can slow the progression of osteoarthritis in dogs? La otra pregunta que tenemos es si hay estudios recientes en donde se demuestre que el control temprano de la inflamación puede retrasar la progresión de la osteoartritis en perros. Okay.
It's a very interesting question. So I'm not aware of studies that specifically looked at this issue because I think it will be very complicated to recruit and to follow up actually in the time to do that. I think that's maybe why it's not done. But for sure, we know that if you start to take care of the disease very early, if you put in place management, for example, you know, as I told you, pet owner education is primordial. So if you put in place management of the weight, management of the exercise of the animal, management also on the way the animal live. So, for example, trying to avoid slippery surfaces and all those kind of things. We know that you are going to, well, reduce the advancement of the disease. But specifically studies, I don't have, no.
Ok. Es una muy buena pregunta y aunque él no tiene en este momento conocimiento de si hay estudios donde se revise la importancia de reducir el proceso inflamatorio en etapas tempranas, sí hay varios estudios en donde se evidencia que identificar la enfermedad desde los primeros momentos y hacer un manejo correcto de todos los factores que están implicados en esta enfermedad va a tener una disminución en la progresión de la enfermedad. ¿Cuáles son estos factores? El manejo, la información y la educación a todo lo que son los tutores, revisar y mantener el control del peso, revisar y mantener el tipo de ejercicios que se pueden realizar, disminuir las superficies resbalosas que estén relacionadas con el animal para disminuir el impacto de manera notoria con respecto a las posibles consecuencias que se pueden llegar a tener. Y el manejo temprano va a permitir que la degeneración de la articulación no sea tan rápida como venía presentándose. ¿Ok? A fourth one. How does it compare the efficacy and safety of Simecoxib compared to other non-steroidal anti-inflammatory drugs in terms of long-term adverse effects? La otra pregunta, que es una pregunta muy interesante que él nos explicó también un poco, pero hay bastantes estudios al respecto, es cómo se compara la eficacia y la seguridad de la molécula Simecoxib con otros AINES en términos de efectos adversos en tratamientos a largo plazo. Ok.
So it's a very good question. So there is no specific studies looking at side effects at long term and comparing, let's say, comparing different NSAID between them on this. So what I'm going to say is more about the different properties that we know of the products. It's not specifically studies because they don't exist. So actually, the first thing you have to see is that, well, Simajax is registered to be used for 6 months. And you don't have that many NSAID that are registered that are registered to be used for 6 months. Then what you have to see is that it's the only NSAID available on the market registered to be used in animals with moderate CKD for a short period of time. And this should indicate to us that it's pretty safe for the kidneys, because if you can use it even for a short period of time with safety at the same dosage as another as in an healthy dog, then it's because it will not create damage. Of course, I mean, you should, in any case of chronic kidney dogs, if you want to put Simaljex, you should be very cautious and advise the pet owner to really take care of the animal and be aware that there is no change in the alimentation, in anything about the animal during the duration of the treatment. And the treatment should be quite short. Okay, so when I say short, it's like 1 week, 10 days max. And again, it's not in a very severe CKD because it's still an NSAID. But because you don't have accumulation in the urinary tract of the molecule, it's the main reason why you don't have an increase of the toxicity of the molecule against the kidneys. So that's, I mean, that's what makes the product, let's say, in a way, safer than others. I don't know if it's if it fully responds to the question or not.
Yes, of course. Pues respecto al tema principalmente de la seguridad con respecto al Simicoxib o los demás AINES que encontramos en el mercado, es la única molécula que tiene registro aprobado para uso durante por lo menos 6 meses. Durante tiempo prolongado, perdón, hasta por 6 meses. Y pues esto se logra por medio de estudios en los cuales se hacen más que el tema de eficacia, porque funciona como cualquier otro AINES, el tema de seguridad. Parte de la seguridad que se tiene y parte de los estudios precisamente con los que se cuenta incluye el uso del producto de Simicoxib, del Simaljex, en animales que tienen enfermedad renal crónica. Y en estos animales, como la molécula no se elimina como un metabolito activo, no tiene ningún tipo de efecto sobre este tipo de animales. Por lo tanto, si nosotros vemos la principal complicación que se encuentra con respecto a la seguridad, está directamente relacionada con el riñón en gran parte de los procesos. Al tener una posibilidad de utilizarlo en pacientes que tienen incluso insuficiencia renal crónica, tenemos la posibilidad de decir que es una molécula que es bastante segura aún para ese tipo de pacientes. Por supuesto, como cualquier medicamento, pues debe mantenerse bajo unas condiciones de un monitoreo particular. No es tampoco que vaya a ser completamente inocuo para el animal y por supuesto debe estar bajo la supervisión del médico veterinario en el caso que sea necesario. Pero los estudios que se cuentan son bastante interesantes en términos de eficacia y en términos de seguridad. Algo que Nicolás no comentó, pero que si ustedes llegasen a necesitar, le pueden pedir a nuestros representantes de ventas toda la información, es la seguridad igualmente en todo lo que son procesos gastrointestinales. No genera ningún tipo de úlceras, laceraciones ni nada a nivel gastrointestinal. Él lo mencionó precisamente en una de las diapositivas, y es que el producto se puede administrar con o sin alimento y pues esto nos permite también tener una seguridad y no genera alteración de los parámetros hepáticos. Entonces, pues esperamos, doctores, haber podido responder a sus preguntas por ese lado. Tenemos por este lado de otro par de preguntas en la plataforma que también están muy interesantes. Simicoxib can have some kind of visceral analgesia, can be used with patients going through gastrointestinal pathologies, and what are the differences between Simaljex and Previcox?
Okay, good question. The first part of the question about the visceral action. We don't have studies about the visceral action of Simaljex, But I will not advise to use it in case of visceral surgeries or any GI tract inflammation, because as any NSAID, actually, it's usually not really recommended to use them in those cases, because even if, well, we have a very safe product, it's still an NSAID, so it still have an NSAID activity, and it's not the best to use those products in case of surgeries of the GI tract. For the second part of the question about Previcox, so actually we have studies looking at the comparison in terms of analgesia of Firocoxib, that is the Previcox, and Simajex. And in terms of analgesia, we have similar activity. Where you will find the difference between the product is on the security and the convenience, because it will go at just what we said before, meaning all the security of Simajex compared to Previcox. So Previcox is not registered to be used in CKD animals, for sure, because really Simajex is the only one. So all the security data that we shared before and during the presentation, they are the difference between Simajex and Previcox.
Ok, muchas gracias. Con respecto a el uso en analgesia visceral, pues para todo lo que son cirugías puntualmente gastrointestinales o problemas gastrointestinales, no se tienen estudios. Pero si ustedes ven en el registro del producto, el registro está indicado igualmente para procesos postquirúrgicos, incluso de OVHs, no únicamente de procesos osteoartríticos. El producto igualmente se puede utilizar como cualquier otro AINES durante el periodo mínimo de 4 o 5 días o lo que ustedes consideren como manejo de analgesia y antiinflamatorios en un proceso postquirúrgico corriente, y tenemos igualmente varios estudios en los cuales contamos con estudios con manejo, por ejemplo, de procesos oncológicos, cirugías de tipo OVH y demás. Entonces, pero para cirugías o dolores gastrointestinales puntualmente, no hay ningún tipo de reporte. Con respecto a la seguridad, a la diferencia con Simicoxib, con Previcox, que es Firocoxib, principalmente la diferencia está en términos de la seguridad, porque el Firocoxib no está registrado para animales con enfermedad renal crónica. Entonces, ahí es donde se juega principalmente con el tema del Firocoxib. En términos de analgesia, probablemente la efectividad es muy similar. Son dos moléculas que funcionan como Coxib normal, pero en términos de seguridad es donde podemos encontrar realmente la principal diferencia. ¿Listo? Y creo que eso nos responde también a la pregunta, una pregunta posterior que había con respecto a la diferencia de Firocoxib. If we need to use the product for more than 6 months, how do you recommend to use it?
Very good question. So it's a question that is very frequent, and actually, so you have to see that it's registered to be used for 6 months. This doesn't mean that you cannot use it for longer. It just means that we have done studies up to 6 months to show that we could use it up to 6 months. Mm-hmm. If you were to want to use it for longer, I would advise to do a checkup of the animal, to do a checkup biochemistry, just to be sure that everything is good in terms of liver and kidney, because you have done 6 months already. And if everything is good, then you can discussing, of course, with the pet owner about it and programming regular checkup. You can totally continue the treatment.
Ok. Para los casos, y esta es una pregunta que hacen bastante frecuentemente, como el producto está registrado para uso durante 6 meses, se puede seguir utilizando sin ningún inconveniente. Lo que se recomienda en estos casos es hacer chequeos a nivel de químicas sanguíneas, a nivel de pruebas hepáticas, a nivel de pruebas renales, para ver y estar seguros que absolutamente todos los parámetros están de manera correcta. Se habla con el tutor y se le menciona precisamente que se van a tener que hacer igualmente unos estudios igualmente periódicos y se puede continuar con la terapéutica bajo la supervisión de cada médico veterinario. Perfecto. Creo que ya terminamos por ese lado. Tengo algunas preguntas con respecto a dónde se consigue el producto, qué costo tiene. Los invitamos a que se comuniquen, por favor, con nuestros representantes de ventas en cada una de las zonas. Los pueden encontrar. También pueden comunicarse con sus distribuidores en cada una de las zonas y ellos les pueden brindar la información. Si tienen alguna otra duda, alguna otra pregunta, pueden buscarnos por nuestras redes sociales o pueden ver toda la información del producto y de la empresa en nuestra página web www.invetcolombia.com.co. Creo que por ese lado quedamos listos. Si llegasen a tener alguna otra pregunta, por favor, no duden en hacerla. Si ustedes necesitan soportes, documentos técnicos para poder estar seguros de la información con respecto al producto que vamos a empezar a manejar, que ya estamos manejando desde hace un par de semanas en Colombia, pueden comunicarse con nuestra fuerza de ventas y con los representantes de los distribuidores para solicitar toda la información técnica que lleguen a necesitar. ¿Listo? Esperamos que haya sido de todo su completo agrado, que haya sido interesante este webinar y recuerden que va a quedar en todas nuestras páginas web.
Así es, y recordarles también pues que va a quedar colgada en las redes sociales y ahí van a poder encontrar el subtitulado para repetirla y la puedan consumir también con subtítulo en español, que ahorita por el tema del live pues no lo logramos coordinar en ese aspecto, pero cuando la repitan ya encontrarán los subtítulos correspondientes. Muchas gracias a Naim por la compañía, por ayudarnos ahí con la traducción, no solamente del inglés al español, sino en el lenguaje técnico. Y Doctor, thank you so much for your time, for being awake so early. And we wish you a nice day.
Muchas gracias a todos. Muchas gracias.
Gracias, Nicolás, por tu colaboración y estaremos en contacto. Seguro que todos nuestros médicos veterinarios que nos están acompañando van a tener varias preguntas, las cuales te estaré transmitiendo para que nos colabores.
Perfecto.
Bueno, les deseamos una muy buena noche y gracias por acompañarnos a este espacio. Chao, chao.
Muchísimas gracias a todos por su compañía. Chao, chao.